Welcome, welcome to the Plus Size Podcast.
Welcome,
How is
everybody.
everybody today? I know it's kind of crazy for me. How
Right.
are you guys doing?
Good, doing good.
Good,
Right. It's a new
good.
week. It's a new
It is.
opportunity, a new fresh start, right? Another
Yeah,
another week to make it happen.
There you go.
yes, that's right. I'm going to work on getting that Rosie story picked up this week too. I'm going to
So
hustle.
that's an opportunity.
Yeah, I'm working on it. That's an
Yeah,
opportunity. Uh-huh. Well, hey,
absolutely.
if you're new here, my name is Kim Carlos,
Hi,
and this
Kim.
is Rachel and Kat, and they're
Hi.
my co-hosts today. Yay! And we're here to talk about today. Our topic is childhood obesity and endocrine therapy. So we're going to talk about for example, Wegovy is a medication that's been FDA approved to treat children 12 and up that meets certain criteria and struggle with things like childhood obesity. We're going to have a pediatric specialist on that is a specialist in obesity as well to be able to have these conversations with us. Today, we are not going to have on a community guest. If this is the first time you're joining, we usually have a guest on from our community to tell their story unfiltered and uncut. But today, because this is a very sensitive subject, because we wanted to really dig into it, it just seemed better. Because what we are learning, as many of us are going through this amazing change, leveraging these medications and having it change our life, is that wait a minute, do we need to consider our children? Wait a minute, do we need to consider our grandchildren? And what does that mean? And on episode 5 specifically, we had on Dr. Daniel Rosen, who told
Mhm.
us about a particular condition that some children have where it's like they can't help but just eat all the time and there's not really a cure for it. And so they have surgery. So, do we want to avoid a life threatening surgery and have a discussion about an FDA approved medication instead? So, even though that's a very uncomfortable conversation because we really are very protective of our children, it's a conversation we need to have. So, we're going to do that today, and we hope you'll come along with us. If you don't know me, again, my name is Kim. I struggled with childhood obesity. I was always the biggest and the tallest kid. I have had a eating disorder since I was 8 years old. I don't know why I'm getting upset about it. Dang it, now I have to cut this. But I have. It's always hard for me to say it out loud because I never did, and basically until I met Rachel on TikTok, which is where this podcast was born from. It's all from the community within TikTok. And it was very emotional, and we're going to talk about it today, and I'm going to try not to let my feels get in the way, but I have, again, taken one of these medications, actually several of them at this point, and lost 65 pounds. I still have a lot more to go, but it's completely changed all of the issues I had with food noise. I have not had any binge eating issues for a year, and I feel amazing, and it is incredible, and I just want everybody to feel like this. So I'm going to get off my feels, pass it on. Hey, Rach. Welcome as our guest host. Tell us about you.
Welcome.
Hi. I have had BED as well since I was 8 years old. I have been obese since I was 8 years old. Also had undiagnosed ADHD since then as well. It affected my entire life, always being usually the only one in a larger body and feeling a lot of feelings about that. Dealt with some bullying, dealt with just some othering, and I think that it affected my entire life and the trajectory of my life. And, being on Manjaro for the past year, the 19th, so just next week or the week after will be my 1 year anniversary. I am down 139 pounds.
It's amazing.
I always forget to say that, but
Remember today, yay!
not today. So it is just an otherworldly experience to not feel the way that I have felt my entire life, and I attribute it completely to the medication. And for those that want it, we all feel like they should be able to have it, and
Yes.
that's why we talk about it.
All right. We're having hard conversations about good stuff.
Yeah.
Thank you for joining us today, Rachel.
You're
So, hey,
welcome.
Kat,
Thank
what you
you.
doing?
Hey
What you got?
there.
Let's go.
I am Kat Doc Carter today because I'm having some struggles with my hair, and I feel like I look like Doc from Back to the Future right now. right now. Great Scott. That's how I feel.
I
So,
love that movie so much.
and as you know, that we have started a trend where I do something silly to my name every time we have an episode. So I'll do that. I like to be silly and ignorant. So mostly silly. The ignorance is after hours,
Oh, okay.
yeah.
After a glass of
So
wine or so.
exactly. Then I really laugh at stupid things. But but yeah, my name's Kat. Kat Carter 7 or at Kat Carter 7 on TikTok. I am the resident Prince fanatic, and I have my AT alien back there with all of some of his Prince stuff, paraphernalia as well. But I too struggled with childhood obesity. I do not remember not ever being slender at all. And I look forward to talking with Dr. Karla because as the years have gone by and into adulthood, I started to really embrace it, and I started to kind of identify myself with it and learned how to really like it and love it. But it got out of hand, of course, with my binging, right?
Yeah.
But childhood obesity was pretty touchy. People in my family were my first bullies and community and things like that, ostracized, singled out. I think singled out is the biggest thing in the family. Being raised with 5 kids in the family, I was the only chubby one,
Mhm.
and so it was just the otherness, like what Rachel touched on. But
Yeah.
things, like I said, things were getting out of hand with my binging as of lately, as I hit into my 40s, probably just aged, and I started to take Manjaro in October. I've lost 60 pounds. I am a proud slow loser.
Me
Um,
too. It's okay.
right, slow
Do you
loser.
ever think that would be a
Uh,
good thing to be a slow loser? I don't know.
I
I feel
think
like
so.
I don't
Yeah,
ever think I would be like, I'm okay to be a slow
it's
loser.
okay.
It's,
It's
it's
okay.
okay.
Exactly. Um, Fitness is a big part of my life as well. Always been athletic, always been into sports as well. In my larger body, always. I think sometimes that might attribute to the slow losing, but I don't care. I'm still going to. I'm just. I feel like I'm just now starting to like enjoy all facets of life, if
Yeah.
that makes sense.
It totally
Like
makes sense.
I'm not
Yes.
obsessing about some stupid cake or some
Yes.
stupid fries. Like it's just I can get on with my life and live. And then when I eat, I'm like, I'm not
Mhm.
obsessing thinking about when is the next meal. So
Yeah.
that's fantastic.
Yeah, I
What
love that feeling too. I love
Yeah.
that too. That I said one time, "Oh, like I'm not obsessed with anything anymore," because I used to have a debilitating
Hmm.
obsessive anxiety, and it turned
Well,
off like a switch for
that's
me.
great.
And so I've noticed though it's not that I'm not obsessed with things anymore. It's that I'm obsessed with what I want to be obsessed with, and I can harness it all into making things like a podcast, right? As opposed to worrying
Good
about
point.
said cake,
Yeah.
right? Like, and I don't feel bad about it. Like
Yeah.
I can obsess and it doesn't feel like a dirty secret. Do you know what I mean? And I think that's been all the difference in the world for me. Just like the mental piece of this, because so much of obesity has to do with the brain. And speaking of that,
And
we have a
hormones.
guest. We have a guest. Okay. Why is anybody dancing with me? Where's Janine?
Oh
Come
yeah. Oh, I'm sorry. And I'm wearing my
on.
sparkly shirt.
There you go. We forget. Dr. Karla
Got
is
my
going to
jazz
be invited
hands.
on shortly once I click the button. And she is going to tell us about her, what she does, and we're going to ask her all the questions so that we can learn together and find whatever that path is going forward, whatever it is for you, whatever it is for someone that you love that may be living in a bigger body and a younger age. Okay, here we go.
All right.
Hey, Dr. Karla, how's it going?
Good. How are you?
We're doing good.
Thanks.
Oh, look. Tell us
This
about
is
your heart.
my whole platform is self-love superpower. So
I
self-kindness
love
and
it.
your health goals. So thank you for sharing your stories. Of course, I've taken care of so many patients and children over the years. So thank you for sharing. I'm so sorry for your trauma. Self-love superpower to you.
Thank
Thank you.
you. I
Love it.
love
Love it.
it. Oh,
Awesome.
warm and fuzzy
Well,
beginning.
if you
That's
could
great.
tell us a little bit about you, because I know everybody follows you, and of course I'll have all the places to find you, but tell us a little bit about your career and what you focus on and maybe why you chose to focus on it.
Well, first of all, thank you for your advocacy. Thank you for doing this work. Thank you for
Yes.
getting this out there and creating community, because that's what my work has been about, has been creating community. And so I'm a pediatrician. I have been a pediatrician for a long time, and I've kind of done everything you can do as a pediatrician. And I had a private practice full of patients who I loved, and I started noticing that I was diagnosing and referring to endocrinologists, kids, young kids who had prediabetes or starting to have type 2 diabetes. And when I was in residency, we called it adult onset diabetes. So it's like, wait, what are we, seeing this trend here? And so was following the recommendations of the American Academy of Pediatrics all along. So this was in 2004. I started what was called a Healthy Living Clinic in my practice. So children and families would come, and we had a PhD psychologist and a dietitian and myself and an RN and a fitness specialist. And we would have families come and created this curriculum, and it was really fun. But it was like, well, that's not really enough, because when they leave the clinic doors, I was like, this is a public health issue. I'm not in the community where they don't have access to healthy foods or built community, or PE's been taken away. And so it was like, I started thinking, well, that's fine. I feel fine about it, but we need to do more. And that's when in 2007, the American Academy of Pediatrics published the expert committee recommendations for how a community pediatrician can assess, prevent, and treat childhood obesity. And they published that along with 14 other organizations. And so I just was like, oh, here we go. And it was just like this kind of like bullet point approach. And it, had everything from, of course, BMI focus, because we've been very, we can talk about that and the harms of that.
Let's do.
Yeah. We could go on forever about that. But it, talked about BMI and screening and what to do in the clinic, but then also, kind of the policy advocacy. And then at that point, they were recommending what was called a staged approach to treatment. And so it was like, okay, start with your pediatrician, and then maybe come for frequent based on BMI and the comorbidities. So if you had prediabetes or fatty liver disease or PCOS, then you would come in more frequently. Maybe you would involve a dietitian. And then it went on up to like multidisciplinary team, and then up to like tertiary care, like what's found at children's hospitals. And then it was like medications, which at the time there were really any, or low calorie. They were advocating for calorie restriction, unfortunately. And then bariatric surgery. So that was kind of the treatment approach. So I left my practice in 2008 after I launched a nonprofit called Teach a Kid to Fish, creating community solutions for children's health. And I love that. That is the love of my career. And cool. I built this beautiful community collaborative from scratch. I remember when my husband's like, who's going to fund it? I'm like, we are. And I'm leaving my practice. It's just like, I had to do it. And so we focused on healthcare and early childhood and school systems and community. And we had just so many beautiful programs. And it was a nonprofit. So it was a lot of grant writing, a lot of collaboration, and a lot of policy advocacy too. And so over time, I wasn't going to start a clinic, but I kept getting calls from school nurses. Where do we send this kid? And we had a Body Works program in the community that we were running in different like cultural centers, after school programs. And it was awesome, but it's like they really needed a healthcare approach. So it took me 3 years of grant writing, partnership development, coming up with a business plan, and working with children's here in Nebraska to launch in 2015 what was called the Heroes program. So that was a weight management program. And I was the medical director for that. And then I was like, wow. I mean, the thing about pediatric obesity is it's super complex. I mean, you are sharing your stories. And I mean, pediatrics is the most complex medical specialty, I think. And I know that's true. And so we don't have a lot of us out there. Like all the training I've gotten has been just completely on my own, you know?
Yeah.
And so the next thing after the clinic got going, and I know this is a long story, but it's all important stuff.
Well, I mean, no, that's
Yeah.
it's important. Yeah.
So then I started working with children's on, there was a lot coming out around ACEs, adverse childhood experiences, trauma. And I went to the National American Academy of Pediatrics conference and exhibit in DC. And I heard Dr. Nadine Burke-Harris talk about the effects of adverse childhood experiences on, you know, the body, chronic diseases like obesity and mental health issues. And I'm like, this is what I'm seeing in my practice of social determinants of health. And so I had been meeting with children's, the population health was becoming really popular, where you look at really like value-based care. That's when the Affordable Care Act was coming out. And so I'm like, this is what we need to focus on. And so I started working with children's here to acquire my nonprofit and launch a population health center that I led. And that started in March of 2016. They acquired my nonprofit assets and we focused on a systems approach. And so the whole task for me was to build out a whole continuum of care for childhood obesity, on up to prenatal, to treatment, to doing research we had collaborations with the university, and did some amazing work with the American Academy of Pediatrics on a project called Project Echo, where you did telementoring. And the sad thing about that is I was caught in the crosshairs, and I've written about it and did some TikTok posts on it recently and published an article in Kevin MD. I was caught in the crosshairs of what's happening to a lot of physicians in healthcare. And that's moral injury and whistleblower retaliation for speaking up. And so the more I spoke up against who was a toxic CEO, the more those programs got cut. So every time I spoke up, they would cut something. So they cut the program database that we had with the university. We're working with amazing NIH researcher on things like executive functioning, ADHD, food decisions, binge eating disorder. I mean, amazing work we were doing. We were looking at 100 different things, obviously not just BMI, health markers, and they would just cut it. And so it was just severe moral injury. And finally they said, we're replacing you with an untrained nurse practitioner in a clinic that I created, and I was still there. And so over time, that got to be so difficult that my attorneys directed me to resign, because it was just so severe. So I was like at a crossroads. I resigned. It was effective immediately in 2019, September 29th. I was truly at a loss because they had acquired $500,000 of everything I created.
Yeah.
And it was like, what do I do now? Like, I don't feel like I've been helpful. The other thing is I went through my own weight loss journey. So I discovered like life and weight coaching. I read the obesity code. I learned about insulin resistance. And I was speaking up saying, we need to be talking about the epidemic of insulin resistance. That's what this is. We can't restrict calories. We're going to cause harm. You know, I was like, BMI isn't helpful. I mean, it's at best net neutral, but it doesn't mobilize a teen, especially to do anything. No. It's boring. No.
Yes.
Yeah. And so I'm like, we've been getting it wrong. We're not doing enough. So anyway, I was like, what am I going to do? I started working with a coach, and I decided to go to life coach school. And then I took my obesity medicine boards, and I launched IME Community for teens. And then to create this community online and connect digitally, I'm like, I'm removing the middleman here. It's just going to be me, compassionate connection, creating community with compassionate connection, which is what you all are doing. Nice. And then I just launched the drkarlamd.com metabolic telehealth for children and adolescents, which is a really good time with the medications, and I'm licensed in 10 states. So
that's amazing.
That's right.
Yes.
That's great.
Well, I love that, because like what I could hear the whole time you were telling your story is you're a disruptor. Like that's who you are, you know? And this is an area that I think we can all agree needs some disruption. So absolutely. I like that. I love people that shake it up. Love it. Challenge the status quo. Mm-hmm.
Yeah.
We're going to be cool. that's
Nebraska,
awesome.
right?
Gotta be loud.
To Nebraska.
Yeah.
Gotta
Anyway,
go loud. Yes. All right. Well, that was so great. It was so now it's good because people, if they don't follow you, they can go follow you and learn all these things, which is amazing. I love people to be able to have a resource with their kids. So I was talking kind of in the beginning about how a lot of us have found that in going through this incredible journey, like we all are so sick of hearing the word journey. I know we are, but it is it. And as you go through it, and I think that my friends here have had this similar experience, all that mental stuff as a kid, right? Like you have to unwind all that because the weight goes and the noise goes. And then you're like, how do I soothe myself? I always used to do with food and now I don't want to. Like, what do I do? And it is just this massive mind shift that you have to like cope with and like deal with and do the work on like while it's happening. And it's intense. It's the best thing that's ever happened for me, but it is really intense. But as we've gone through this, as I mentioned earlier, all our friends are starting to say things like, what about my kids? Or what about my grandkids, right? For those who are starting later, right? And now we're like, do we do that? Because it's very difficult to think about giving our child a medication they may need to take forever because one, they're our child, and two, forever is a long time. Like it's a long time for us as adults, but it's a really long time for them, And but sometimes I think we need to understand like when would that be a good use case, if you will, to do those kinds of things and make those decisions, and what things should you try first, and how should you have those conversations with your children. So I'd love to be able to touch on some of those today. So I'll get to first question. So you're a specialist in this area, and I know a lot of people are considering like, is this something I need to do with my child, depending on what age? So we know Wegovy is approved for children that are 12 and up that struggle with obesity, and there's different criteria that they would need to meet as opposed to the criteria we would need to meet as an adult. So what is that, and how do you make that choice to even think if that's something that's right for your child?
Okay, thanks for the question. Okay, so first of all, we have to understand that the FDA has approved the medication, so Wegovy, semaglutide, for children 12 and adolescents 12 and up as an anti-obesity medication. So the most important thing is we stop calling it weight loss meds, especially when we're dealing with adolescents and children. And it's an anti-obesity medication. Obesity is a chronic disease. It's not like insurance always views it that way, but we know that it is. And so there are laid out criteria. Okay, so if it's class 3 obesity is a BMI of 30 or above, I know we could talk about BMI forever, but this is just how it's laid out. And then the class 2 obesity is 27 to 30 with comorbidities. So if they have prediabetes, type 2 diabetes, PCOS, fatty liver disease, those types of things, then they are eligible and meet the criteria. So first you look at the severity of the obesity. You always want to look at the weight gain, the trajectory, the comorbidities, so the metabolic diseases that are associated with the weight gain, what has been tried in the past, obviously. We look at things like the family, patient preferences, and we look at things like their eating, phenotype, whether they have a lot of cravings, food cravings, and a lot of insurance plans obviously want you to try something first. Have they been on metformin? The thing that is different for children and adolescents is that there's these recommendations of 26 to 52 hours of comprehensive behavioral support. So like high intensity treatment around, self-monitoring, goal setting, problem solving, behavior support, nutrition, fitness, physical activity, education, all those things need to be in place to prove those. So they'll often ask, have you done this for 3 months? And so that's where I come in to help support that with the clients who I coach with, for sure, and offer with my metabolic telehealth. So yeah, it's a nuanced conversation. But I work with some parents who maybe they take the medication and they've had a lot of success with it, and they would like to open up the conversation with their teen, but they don't know how to approach it. And I usually, because I coach both the parent and the teen, I know kind of their relationship, and sometimes I coach them both together, and I'll be like, you have a really good relational health is what I call it. So just be really transparent about it, because oftentimes they'll be like, they don't even know I'm taking it.
Yeah.
And if you think of it as a health issue, then there's no shame here, you know.
Yeah.
And usually the teen is like, maybe they've heard about it, or you know, they're very open to it. And then that's like one obstacle. And then I'm like, but I mean, you can have hope. Things are going to change, obviously. I mean, these medications have become more readily available, but right now there's a shortage of the lower doses of Wegovy, so we're not even that's not going to open up until September. And then there's, you know, issues with their own, you know, getting the prescription. So sometimes if they're not a patient of mine, but they're coaching with me, I can, you know, say, okay, go to this doctor here, go to the endocrinologist, just ask the doctor for it, because they're very ashamed of, you know, and having that conversation with the doctor too. So for the parent, it's like not only the conversation with the teen to open it up, but it's also the conversation with how are we going to approach it with the doctor.
Yeah.
You have to get over your own internalized weight bias for that. And then there's the next obstacle of, okay, is this going to get approved? And then, you know, as you all know, you know, can be
I have a couple of questions if it's okay. Just it's naturally coming up. So my son is 10. He does not appear to suffer from any kind of, I would say, genetic piece of this, but his dad and I are both as adults obese. Now, I always was, but my husband was not. My husband was always like, if not like just skinny and active and could eat like a bag of chips and, you know, just that's just how it was. My son seems to be sort of in the middle. He's a little, but he has a lot of issues because he's autistic with like sound and taste and texture. So like the sensory stuff. And so we're having a lot of conversations around like, what does nutrition look like? So because there's only a few things that are kind of safe in his mind, and there's a lot of like therapy and things that go around that, right, to help him. But it's hard to be able to have a conversation with your kid about nutrition when you went through all the things that I went through growing up, like diet culture and binge eating and stuff. But I find that it has helped. Like you said, I'm talking with him like health, and he's very into the podcast. Like he's like, you should have friendship bracelets and for your community, and the money can go for the podcast. Like he's very into it. So it's helping with the conversation around that, you know. But I always know in the back of my mind that genetics are a thing, you know, and I know that, and I worry a little bit about that conversation. And I do think that because, again, of all the things that I've been through, so not only is it difficult to talk to him about it, right, but it was very difficult to even consider having that conversation with my doctor. I can't even imagine having that conversation with his. Like that, because I have such aversion like to doctors, because I've been told it's my fault and that I'm lazy and that I'm fat and my whole life, you know. Turns out I'm not. I'm kind of awesome, you know, but I was sick and I needed help, you know. But I think that's something that we have to think about. Like that's another step. Like you said, it's so difficult to even consider it. And I think that immediately as a parent, we're wanting to protect, right? And so when you hear someone say, let me give your kid a shot, you're like, you know, no. And you're not even willing to like open your mind to go there. But we've seen some people recently on TikTok, and I know there was one that you duetted where she was talking about, hey, she had made that choice because her daughter had PCOS and that she went and got the prescription for Wegovy and was treating that way, you know, and then she was getting a lot of hate for it. But I liked that she said that she felt like she had a responsibility, you know, to talk about it, you know. But anyway, I just was curious kind of like what your take is on that, about like the parent that is struggling with obesity, right, or that has, and that it's hard for them to have a conversation. Like, how do they get past that? Like, how do you even get to a place where you're okay to talk about that? And what are some language you should use? You know, what have you seen that's been easier for some people, and they thought, oh, well, hey, you know, I wish I had started like that, or I wish I had said this years ago. You know, like, can you think of any moments like that?
Oh, yeah. Help our listeners? Again, self-love superpower to you for all your trauma. Yeah, there's a lot of either internalized weight bias where, you know, people have grown up like you're explaining and you've taken it on, and there's just a lot of self-stigma and blame and shame of yourself. And that's just like the internalized or just weight bias, right? And I talk a lot about almond moms. I've been on the news about almond moms. I'm like, so I'd be on. That'd be the thing that I'd be known for, almond moms. But anyway, yes, we coach on, it's coaching. So you have to coach yourself. And so as a parent, we're not like perfect doesn't exist. And your kids need to know that. You have to get rid of perfectionism. Okay. And so you're being real, your relational health with your son is all that matters. He doesn't need to be an RD. He doesn't need to know all the stuff about nutrition. But I teach teens about protein, and
Yes.
if food is energy, and like what's a quality food, and it's like, okay, so they're just a little bit more mindful of it,
Yeah.
and like hydration and owning their own health autonomy. And so what you have to be is a role model for self-compassion. You don't have to be a role model for your weight, for your size, for your fitness, for your eating. No.
Yeah.
In
Yeah.
fact, unless you talk about it and just make it your own health journey, and you're there to support your kid, who sounds like an amazing advocate and activist, he's awesome. So, you just want to like support that. And obviously all the things you all are dealing with on a chronic and, those are complex issues that you have to show up and work through.
Yeah.
And don't worry. Parents I was coaching a mom and a daughter. They were deciding whether to kind of work with me long term. And in the beginning, I'm like, it's going to be awesome. And I just love this girl. And they liked my self-love superpower approach, my kindness. That's kind of the first thing. And then we talk about metabolic health, and we talk about protein, and we talk about quality macros, and getting your body fat adapted and all this stuff. And the coaching tools, and they were on board. And then the mom started in, because the mom grew up and she's on the medication, and the mom grew up obese, and she has it in her head, and she had that weight bias, and she was like, she just couldn't have it. And so then I saw the little girl, like she's like 13, I think. So I saw the girl, like when the mom said, this is all well and good. Some parents don't like the self-love superpower. They're so stuck on the rigid, grueling perfectionism is the way to motivate and get to the goal, because that's diet goal.
Right. Yes.
So she's like, this is all great. I love it. But we have obesity in our family. And she said obesity like 5 times. We have obesity in our family. And so then the girl's like, oh, and it's just like, I could see that they weren't going to work with me, because they want almost like permission to restrict, like to be that kind of diet culture. And I have these 4 pillars: no calorie restriction, be a soft place to land, you determine your own measures of success, and all health habits count. And it's like, I hope later on they'll connect, but you have to really coach yourself on your internalized weight bias. Like, that's your work.
Yeah.
Parents have to do the work.
It sounds like,
So
especially
true.
with internalized weight bias, I'm sure, because all 3 of us were, I would say we experienced childhood obesity. Can you discuss further the emotional development issues that childhood obesity can cause in the moment, and also, like, say, later on down the line in adulthood?
Well, it's associated with obviously like depression, anxiety. The quality of life measures show that, some of them show that that's worse than a child who's going through cancer treatment. A lot of it is based on bullying, weight bias that is becoming internalized. And the thing that I learned from the researcher I was telling you about, his name's Dr. Tim Nelson, who's a PhD psychologist here and has a child health lab, is he taught me early on with my nonprofit, when we were doing work together, not only the power of positive messaging for health behavior change, for motivational change, but also that people really get mixed up when they think that the obesity is what causes the depression and anxiety. But it's really that's not true. It's the bias in the society. It's that internalization. And so when you have, like you experienced, Kat, when you had the first bullies being your parents, I mean, where's the safe place for you?
Right.
I mean, I wrote an article about that. Parents stop weight bullying your kid, because there's research that shows weight-based victimization is really a problem in homes too.
Yeah. And I think that's something that, like, just in general, like as parents and specifically, right?
Mm-hmm.
No matter what trauma we've been through, weight or not, like the chances of us putting that on our kids are kind of high. Like we can try our best, and I do, trust me, but it's going to happen. So it's like it's a matter of you, I think, like you said, like recognizing it and doing the work on your own to figure out how to best handle that,
Yeah.
because it is there, you know. But I think that it's important to have hard conversations, like this, and learn things that are difficult to make us uncomfortable. So I'm hoping people will learn from this.
Yeah.
But yeah.
And you can have a lighter approach to it, like when you catch yourself, like you're yourself. Oh, there I go again. There's because I bring out my thought rainbow when I'm coaching. So our thoughts are like a rainbow that come and go in your mind.
Right.
You don't have to attach to them. And so a lot of people who grew up struggling with their weight have a lot of past self-beliefs that keep them stuck. And every time you try to take action on a goal for yourself, you go back to that and your mind's like, oh, all the evidence comes up. You can't do it. You're a quitter. And teens have this too. And so your past self-beliefs are only your thoughts about your past self.
Right.
So you have to really do that coaching to say, oh, why am I getting stuck here? Every time you take action, you're going to have doubt. You're going to have, not have confidence. You're going to indulge in overwhelm, but you keep, like you all are doing, you're taking the action. Okay. One thing I want to go back to that I didn't hit on was like the bullying and also social phobias. So social phobias are really strong in kids who struggle with their weight in our society. I mean, thin privilege is real. Weight bias is so bad. Bullying is terrible. And the parents are dealing with, like, they don't want to go to school, obviously. They're not reaching their potential. And so that is, it creates a lot of anxiety. So that's one thing that we work on. And then every client I work with, if I'm coaching them, and then every patient I've ever worked with has experienced bullying of some sort. And then so we work a lot on bullying. And so how to set boundaries, how to be an upstander for yourself, how to create bully bans that you practice. You may never use them, but they may be something like verbal, like a neutral statement. We get really detailed about it. One mom and son I was coaching, her son was really struggling. Like there were a bunch of mean girls calling him hunchback. And so she met with the 504 team, and they came up with a plan to create some physical boundaries around the bullying.
Can you tell us what the 504 is for people that don't know?
Oh, I'm sorry. Yeah, that's a plan. Like if you've heard of like an individual educational plan for maybe kids who have ADHD, health issues, behavioral issues, learning issues, then they have a plan in place for accommodations and support. And so anyway, you have to get kind of creative, but one of the things we try to do is we don't want the kids to internalize that. We want them to feel like they can be an upstander, that they're not constantly having to be reactive to it. And obviously, if the parents need to step up, they got to step up.
Right.
Yeah.
Okay. Well, speaking of, we're expanding more on childhood with Dr. Daniel Rosen. He was on our episode 5. And he told us there is a pediatric, there are pediatric bariatric surgeons, which that kind of surprises. You don't think about that, but of course. But he used an example of the Prader-Willis syndrome as a good use case for surgery. But he also mentioned if there is an FDA-approved medication available over a life-threatening surgery, it's important to have that conversation no matter how controversial. So what are your thoughts on that and on that topic?
Well, first of all, when I started my pediatric weight management clinic, we have at Children's, they're pediatric surgeons, so they take care of kids. They're really amazing doctors. It's hard to be a pediatric surgeon. It's one of the toughest fellowships in surgery. Yeah. And so they take care of the very sickest kids. And then they also do not all of them. Some of them do bariatric surgery in adolescence. And so I know the ones I worked with here were kind of drug, kicking and screaming to learn how to do it. But it can be a helpful tool. I mean, it's a tool. It's obviously a very serious one. Usually it's a sleeve gastrectomy that we use in teens. So usually they tolerate it pretty well, but it's obviously a huge life-changing surgery, and they need a lot of supports that sometimes aren't always in place. But the important thing is that you're reducing disease burden with metabolic bariatric surgery in kids. So it's I had a couple prader who had it and they tended to do pretty well, but I mean, there's a lot of it's very complex. So for Prader-Willi or any of there's a whole host of genetic syndromes. Usually those are kids who are going to present with developmental delays, and not all of them, but the things that are the syndromes like Prader-Willi that you think about, they're going to have a constellation of findings. So typically they don't grow well when they're babies, maybe like in Prader-Willi, you have hypotonia, delayed development, and poor growth, maybe the opposite, failure to thrive. And then they'll start in with their hyperphagia. So they'll get severe obesity early on and like this insatiable appetite. And then there's other genetic, monogenetic syndromes or that we can test for, where we can do genetic testing now to see if there's other things like POMC deficiency or other like even more rare things that maybe they don't have the developmental issues that go along with it, but they'll have obesity at kind of early onset. And so those are kids who should be tested for that. And the AAP, American Academy of Pediatrics Clinical Practice Guidelines, I don't know if you're familiar with those. Those were just released a few months ago. They got a lot of flack because these are really good pediatricians, but they came out with what, we should be doing, be a really aggressive early on. So they did recommend pushing the bariatric surgery, but the medications and the anti-obesity medications, especially the GLP-1s early on. So that's, the hard thing about it is definitely for a kid who has a genetic syndrome, complex obesity, or, severe obesity, especially early on. Yes. Get the medications in. It's hard to get a prescription because, I mean, they usually have to go to like a children's hospital or go to a pediatric endocrinologist to get the prescription.
Okay. All right. That's perfect.
My dog's barking like really loud.
No, it's okay.
Sorry. I was like, mute. I didn't want to interrupt you. You were doing so well.
They're into the podcast. They're interested. They want to come in and join and talk with us.
And it's the little one that thinks she owns everything.
Of course.
Like she's the smallest of all of them. And I have a lot of dogs. We have a service dog. It's a whole thing. So I don't know. I have one kid and a bunch of dogs. I don't think I'm any crazier than somebody else. I'm a bunch of kids. It's like, it's fine. Everything's fine.
Yourself.
The flames behind you, Kim. And
I know. Everything's fine. That Elmo with the fire going. That's what today's like for sure.
Hilarious. It is.
So when you're like, if you're going to be sitting down and talking with your kid and finding out, or even if you're not talking with them, like maybe you're having a conversation with the doctor about their weight, like maybe that happens at a certain, like you said, like when you're doing developmental things and you're talking with their pediatrician, like how do you advocate for your child with this? So I think that's another thing is like, once you've decided to have the conversation, how do you, a lot of this podcast, when we were putting it together, was we want people to understand their disease. And we want to understand that they're not alone. It's not their fault. And then that these medications can treat it and how it treats it and what that looks like and how that can manifest in you. So I think like, how do you do that? Because I feel like even the best pediatricians are going to be uncomfortable with this. So like, are they given guidelines and they are following them? Or do you have to fight just like we do as adults? Like what's that going to look like for them?
Well, this is such a great question because it's kind of hit and miss. So like I said, the AAP clinical practice guidelines came out and they were really aggressive. And when you look at, I mean, there's a lot of helpful stuff in there, but I think it was a little bit alarming, like to like, do not pass go and, use these GLP-1 medications or recommend surgery early on. And it's almost like they threw lifestyle therapy out the window. And
Yeah.
so one of the things is we haven't, I wrote an article, Healthcare's 3 Epic Childhood Obesity Fails, and one was focusing on BMI and that calorie restriction, energy imbalance theory is wrong. It's not how our bodies work. And we haven't supported parents is another thing. And we haven't addressed insulin resistance. And so pediatricians don't talk about the real epidemic, which is insulin resistance. And so one of the things when I see these things on TikTok or people saying, you're taking medication away from the diabetics, if you know about insulin resistance, even though we don't have great indicators. So if you know about it, you understand that somebody with chronic obesity, even though they may not have the diagnosis of type 2 diabetes, they have insulin resistance.
Yeah.
And so it's all, I mean, and the GLP-1 receptor agonists, when you look at their mechanism of action, they treat insulin resistance. I mean, it's like glucose dependent release of insulin from the pancreatic islet cells. It's like restoring how it's supposed to work. Yes, there's a delayed gastric emptying. There's the work in the brain, to quiet the cravings. Anyway, pediatricians don't know a lot about insulin resistance. They don't talk about they're stuck in weight bias. They're stuck in BMI. That's how it's been. So I think a lot of it is weight bias. So please don't let your conversation with the pediatrician be the be all end all. Okay. So if you feel like, this is a conversation you want to explore, then just have the intention to do that. Okay. So you may have to, again, coach yourself and you can decide, I'm going to show up curious. I'm a scientist for my kid. I'm just getting some information. And then maybe they'll be able to refer you to like a tertiary care clinic at a children's hospital or a pediatric specialist, or look on the abom.org to find an obesity medicine specialist. There aren't a lot of us who are pediatricians, but you can look there to maybe find somebody who would be comfortable writing the prescription.
Something I had only thought to ask now, because you were mentioning a lot about like some criteria for children. So as adults, many of us are struggling with our issues with our insurance having weight loss carve-outs, right? They don't have necessarily a anti-obesity thing in their insurance. Is it different for kids?
No.
It's the same.
It's the same and even worse for kids. So, I mean, they won't cover anything that is weight loss. They call it anorexics. So, when I call and I do, they call it anorexics, the insurance plans for kids. And so that's, obviously I just keep ignore. I'm used to advocating on lots of different child health issues. So, this is learning advocacy for you all. You're doing it by creating a community, but you get data, you share your stories.
Right.
And it's just like, getting coverage for insulin or EpiPens. My kids have food allergies. I mean, this is the same thing. But I'm working with one of my patients now. She's a perfect candidate for Wegovy. And I wrote her the script and then they rejected it. And then I've had several calls with them and they are just like, we do not cover anything that is an anorexic, which I was like, wow. And I'm like, and this would be the greatest candidate. I mean, her mom is taking it. And I don't want teens to go to the extreme of, getting, or the parents to go to the extreme of getting the compounded. So we'll just keep advocating and there may be different things that we can do. And over time, I hope that changes. But no, it's the same or worse for kids.
I don't know why that shocks me so much, but like that was like hard to hear. I would hope they were a little bit better, with recognizing these things in kids, but like as some sort of medical treatment. Obviously, doctors are not going to prescribe a weight loss medication for a child that doesn't need help, but I guess they don't care.
It's so controversial now too. Like it's just, Wow, it's all over. Like the podcast I listened to recently, they got heated on it. Like it was, yeah,
Yeah.
Well,
like it was like a debate back and forth between two doctors. Yeah.
Frustrating.
Well,
That sounds good. Send me that.
it can be a really helpful tool. And if you have like the mom you were talking about, whose daughter, she's on TikTok, her daughter has one of the genetic, like kind of rare, not Prader-Willi, but another like kind of rare genetic metabolic issue. And so if you have that, I'm assuming that it's going to be, hopefully easier to get covered.
Yeah, I hope so. At
Mhm.
least something to fight with.
Yeah,
Data,
and
you know?
pediatricians are not, most of us, they don't have the physical time to be doing prior authorizations and writing letters and making calls. And, it's not their area of expertise. So that can be a
Yeah.
barrier, but the more that you can advocate, just don't let it be a wall. Just keep
Right.
going.
Yeah.
Yeah.
In your work with teens and obesity, you utilize the entire spectrum, meaning the family and specifically the parents. I downloaded your guide, Cut the Cringe, which helps family with conversations around weight, body image, while in a loving environment. Could you touch a bit on that for us and just give us a few like takeaways for our listeners?
Oh, thank you. Thanks for reviewing it. I know it's a long script. It's called Cut the Cringe. I always create value when I see a problem coming up, which is why I like being on TikTok, because I can disrupt stuff, but I can learn more. People share more with me as I'm coaching them too. And then I can learn. And so what I was finding was the conversation that the doctors had with, with the patient, whether they said, oh, your BMI is high, your kid's in the overweight category. They didn't ask permission. They didn't give consent to have the conversation. And it was a very weight biased, conversation. Or I found just a lot of parents still stuck in kind of diet culture, and they want to get into fix and solve. Their teen's broken. They're getting into panic. The doctor blames the parent. So, and they blame themselves, and maybe they have internalized weight bias. So what do you do? Like Brene Brown talks about, we're going to armor up because we have shame, and then you're going to get into rigid fix and solve. So I'm like, I want to have us move from compliance to compassion, because if we have compliance where we're just telling somebody what to do, whether the physician or the parents, they're going to ghost us. I mean, it's going to not be helpful. And you're going to, even if you have good intentions, you can cause harm as a parent. So that's what we need to know and understand, and physicians too, is that we have to be mindful of how we have these conversations and open them up. So we want to listen. So we want to what did you think of that? I heard that, what did you all talk about? If they don't want to talk about it, then just let it go.
Yeah.
Right.
Or how can I support you in that? Or, because what you want to do is work on your relational health, and don't think that it's a one and done conversation. So as parents, we're completionists. I know I am. I have 3 kids. I'm like, I'm already done with that. Like, I thought we resolved that issue and we're good. And I'm like, it keeps coming up,
Yeah.
And so don't label your teen. I mean, we always do. They're like, he's not motivated. Oh, they're a lazy eater. And I wrote that script because I had these workshops, and I was having some parents come, and I was excited to cancel diet culture, call out the harms of, weight bias in our lives. And they were just not ready for it. They were kind of like more almond moms. And I was just like I had to coach myself in those workshops to say, you are a pediatrician, you're here for the kid, Karla, like, you're not gonna like double down on this. Mom's saying, like, my daughter's such a lazy eater. If I cut up vegetables and have them in the fridge, she'll eat them. But if not, she'll just go to the Oreos. I'm like, as we all do, and just saying things like, well,
Exactly.
yeah, my daughter's totally body confident. She has a healthy body size. She dances. She has friends. She's body confident. but I can't help but, and the mom had brought all of her stuff in and had an eating
Mhm.
disorder, and she's trying not to say anything to her because she would judge what she's eating. But she's like, I feel like my daughter would be better at a size 0. And she was like a size 6 or something. And I was like, uh-oh. I'm dealing with something more intense than I ever thought existed. Because there's no way that a parent would share that with me in practice, that they were wanting that. And so time after time when I would do these workshops, that's what I was finding.
Yeah.
And now I get to work with amazing parents who are the opposite, who are like you all, where it's like we just work on it together. They're
Mhm.
in the mix, and it's awesome. And some of them, are working on getting their kids prescriptions and trying to get them help. And they have a very health-focused approach.
Yeah.
That's great. It made me think of, I'm having a thought too. I'm sometimes I can be torn on this childhood obesity thing as far as like treating it with, like, say, with Wegovy or whatnot. It's because sometimes wonder, and for many of us, had we not been singled out, had we not been ostracized, I know I had this, it was like indulgence, restrict, 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 or the entire family. That's what, just in my instance, the entire family can have this fabulous candy, this dessert. You need to go downstairs, Kathy. You don't get to have it. So the whole singling out, I just wonder, with the combination of that and with what we're presently talking about right now with GLP-1s, I wonder if something could have been changed, like, would it be as bad? Do you see what I'm saying?
Yeah. Yeah.
And I was going to play just to ask a question about almond moms, but I do wonder if it could that have changed? Could that have changed a course? And I don't want to it's going to turn this into a therapy session, but
No.
Why
I
not?
do always wonder about that. So, but yeah, there's the heart.
Yeah, because
um,
that's so hard for you. I mean, that's trauma, right?
mhm,
That's
mhm.
trauma. And I'm sorry you went through that, because your family had a lot of just weight
There was
bias,
everything.
power
Yeah.
control, like scapegoating, whatever. I mean, it sounds awful. And it's very common, unfortunately. And so, the whole society is messed up. We have severe weight bias, discrimination. And I did one video, gosh, it's been a while, but it kind of, I don't know, it wasn't totally viral, but it kind of was.
Mhm.
It was like, is your pursuit of weight loss or your pursuit of health actually a pursuit of thin privilege?
Oh.
And people were like, oh, hell yeah. Yes, it was. And I, like kind of get mad at me, like, of course, because I've gone through all of this harm.
Mhm.
And so I find that, like, in every teen I coach, when I ask them what they really want is to be comfortable. And I push them on it a little bit, because I'm like, so you're seeking comfort within a system that has dehumanized and peripheralized you and caused you discomfort.
Yeah.
And so I'm like, it has to be something more exciting than that, and it has to be your individual health journey. So there's, that was my concern with the AAP coming out with these guidelines of, like, do not pass go. And the first visit, when you diagnose obesity, a pediatrician in primary care should be talking about referral to surgery or a GLP-1 receptor agonist, right away. And it just seems so harsh, especially when we're not really addressing, all these other issues.
Yeah. The weight between your ears is what I like to call it.
Yeah.
Yeah.
And so we work on self-acceptance first. It's like,
Mhm.
one of the things with the body positive movement is, obviously it's really wonderful. And I've been trained by the Body Positive Institute on the 5 components to create, a healthy life. And it's beautiful work.
Mhm.
But one of the things is, we aren't movements. We aren't a dogma. It sounds like it helped you and served you
Mhm.
for a while, but then it also, like, kind of kept you from kind of focusing on your individual health goals. There wasn't really anything out there. You know, of course
Yeah.
people do diets. Of course people stay stuck in binge eating because there's so much shame and bias that, and there hasn't been anything that's been helpful. So of course the medications, you know, actually
Right.
treating this are helpful. But so you said restriction and indulgence. So that's what I wrote an article, Let's Meet in the Middle. So I found, you know, we're either stuck in this toxic positivity where we feel shame for not just loving ourselves and our body and accepting ourselves now, no matter what, versus toxic diet culture. You know, it's like ping back and forth. And really, we're just spending our time and not doing anything and not focusing on health. So it's like, let's get out of it and just here's what we do, one step, one step. And so sometimes that's hard for people because it's like they have all or nothing thinking. But one of the first things I do is like self-acceptance is a warm blanket. It's like invisible. It's always available to you. It's not even an action. You can accept yourself. Now you can accept you want to make changes. That's fine.
Right.
And also I don't go to body, like I love my body. So if a teen is like, I hate my body, a lot of them have a lot of self-judging, body checking all day, and they're really stuck in it. They won't get out of it and they refuse, which I'm like, okay. But when they're so like stuck in it and just like pinging back and forth all day, you know, it's like we just try to go to neutral. I have a body. My body works for me. My body allows me to do this one thing. You know, like I don't think about my body hardly at all. I'm just doing crap all day.
Exactly. I think we forget, I think as an adults, but as you know, I feel I don't have kids, but I feel that it's probably a lot more pressure and stress for teens now than it, you know, was when I was coming up, when I was a teenager. It's way, I feel it's way more intense for them.
It's all or nothing. You know, there's a lot of perfectionism. It's all or nothing. They bring it into the food. So they, you know, they feel the judge and shame from the parents and they pick up on it. So the parents give a look maybe to each other when the kid's eating and they're going for seconds. You know, oh, are you sure you want that from the cabinet? And I'm like, stop it. Sometimes you have to say, they are not broken and they are not you.
Yeah.
Right.
Yeah. Yeah.
They're here to live their own life and you're here to
embrace yourself. Yeah.
Yeah.
Exactly.
So,
Yeah.
You know, I had it's so funny you say that. Like, I think it's like you said, like, especially on the internet, it's really bad. So I got a comment the other day. That's right. I'm talking about you. I got a comment the other day from someone who was talking about how much she loved Rosie and Rosie's episode, but then fussed at Rosie for drinking, I think, a Coke. And I said, we don't do that here. And she's like, what? She has a chef and all these different things. And I was like, and I'm sure Rosie knows that Coke is not the best thing to put in her body. But I'm sure Rosie also knows that she can have a Coke because she deserves to have a treat and a good life like everybody else. You're welcome to stay here, but we don't do that here, you know?
Yeah.
And I think that happens a lot, you know? So it's like, I don't know. I don't know how to make people stop that. And they are more free with those kinds of just harsh comments. Like, what are you doing telling people they can't have a Coke? Shut your face. You know what I'm saying?
Yeah, they're very entitled on TikTok. It can be a trash app. That's what I say. I tell you what, the gym bros, I did one on calorie deficit and they just came after me. I was actually kind of like, ooh, that's the first time I was getting a little bit scared almost. But then I just started blocking them left and right. So that's what I do.
That's true. Yeah, the gym bros, that is definitely a thing.
Yeah.
I have an older brother who was a gym bro, and he used to. This is before when I got married 10 years ago. It's been 10 years. He was a gym bro then, so he would send me so many diet, and I was totally into that whole diet and fitness thing, but still binging.
Yeah.
But yeah, all the tips, the videos, the inspirational everything. Yep. You go, sis. Okay, sir.
Can I ask you something, Kat? Did the medication help you then with the binging? I mean, I know Kim, you referenced that. Or what kind of supports did you all have or find were helpful to help with the binging?
We didn't talk about it where I was. And I certainly didn't talk about it
Okay.
as I continued to progress. Like it was a shameful, dirty thing, and it was just
Okay.
not something, which is a shame, you
Mhm.
know. And like even with my son, you know, he's not a big eater in general, but sometimes he is. And so if I think that it's maybe head hunger, that's what my mom always called it,
Mhm.
I say to him, hey, did you know, I handle it scientifically because because he's autistic, he very much grabs onto facts and he likes things like that, like finite things. And so I'm like, did you know that your tummy needs time to talk to your brain before it knows that it's full? And he's like, no. And I'm like, mm-hmm. And then I'm like, so eat that and then just wait a little while. And then if you're still hungry, you can have whatever you want. And
Mhm.
that's how I handled it. But like when I was growing up, that's not how it was. It was, you don't, I have a lot of grace from my mother. Like I really don't hold anything, but like
Mm.
she was like, you don't need that. That was like her big thing. You don't need that. You don't really want that. You know, and I'm like, you don't know what I would, you know, what I want. Like, you know, like,
Now I really want it.
my sister before is gone right in front of my mom.
Yeah, siblings, those
Mhm.
little turds. Yeah, they're like, ha ha. Yeah.
My baby sister, she's all about really, really. Let me show you. You know, but yeah, I mean, but I know my mom. Like I know my mom very well, and I have now that I'm a parent, it's easier also to have I think more grace for her
Mm.
because I see how hard it is, and I know. But my mom never struggled with weight; she was always thin. You know, not skinny, but thin and healthy and fit and very active. And she played tennis, and she's a golfer even now in her 60s,
Mhm.
and she's just incredibly active. And like and I was active too, but I was obese. Like,
Mhm.
and
Yeah.
there was nothing that seemed to help it. And she would try with diets and Weight Watchers and this and that and don't eat that and stuff. But like none of that helped because I had something at my core and they weren't doing genetic testing to figure out what you had when I was growing up.
Mhm.
So
Yeah.
I'm 43. I'll be 44 this year. So that just wasn't a thing. Like the whole idea of genes in general was still kind of like new, like
Mhm.
coming up,
Yeah.
you know?
Mhm.
So yeah.
Sometimes when I'm coaching a mom will reach out to me and they'll kind of be like your mom. They're not like an almond mom, but they kind of
Yeah.
have tendencies. And
Yeah.
they tell me I can't relate to my
Yeah.
daughter. And they tell me everything they do. And I'm like, yeah, you can, because it's your kid and you're going to need to relate to her.
Yeah. Figure it
Mhm.
And
out.
Yeah.
too, the perfectionism. And then they're like, oh, and I'm go, because that's what this is. It's
Yeah.
not
Yeah.
about her body or food. Okay. There's nothing broken about that.
Mhm.
And I just tell them straight up, I'm like, you're going to need to relate.
Yeah. That's interesting you say that, Kim, because I'm like I'm telling you, we're having like a group session here.
Yeah.
My parents were heavy. Both of them were. My siblings were, slim, but my mom always told me I felt like I definitely learned later on, like it was definitely narcissism. She definitely still challenged with that, but I was a reflection of her. So she apologized to people for me, for my size, for the way I looked. It was such an embarrassment to her because I was so heavy. She told me this many, many moons later, but um, yeah, that's so yeah, that
She seems
was
like
the
an
situation.
almond mom for sure.
Yeah, it was kind of it was yeah, it was insidious.
Mhm.
Like it's just the way sometimes things kind of um rolled out.
Mhm.
Yeah.
Yeah,
Yeah.
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 So I've got a really long question.
Okay. Tell me.
I'm gonna just sip my water for just 1 second.
Go for it.
Um,
Tell us, Rachel.
so I've been obese since I was 8 years old, like I mentioned. And I know genetically I was predisposed to obesity and other comorbid issues like PCOS, ADHD. My dad was a type 2 diabetic.
Mhm.
I can see these issues in many members of my family on both sides. Around that same age, I developed BED, and not diagnosed at that time, but I can recognize it.
Yeah.
Me and my therapist can recognize it.
I think we all know what it looks like.
Right.
If you have it.
Exactly. And so I often think to myself, if I had been treated for ADHD, would that have prevented the BED? And then these two issues specifically, like the dopamine seeking aspect of it, it seems like they played a large role in the dramatic amount of weight that I gained, ending up over 300 pounds. So my question, or one of them, is, do you find that the more comorbid issues that children have, the higher or faster their weight climbs? And do you see a significant amount of children with obesity that also have ADHD, or is that even a part of the conversation with childhood obesity at all? Especially since, like, we now know that inattentive ADHD presentation, especially in girls, is something often missed, and only really a recent conversation to the public. And because most of us have seen benefits for all of these issues, ADHD, BED, PCOS, from taking the GLP-1 medications. So it kind of like leads us to believe that they're all related. And if I had had this treatment when I was much younger, then my life could have been dramatically different mentally, emotionally, and physically.
Yes, I'm going to give you that again, because
for the heart.
people have been through it.
So cute. She's like, bam.
Yes, we do look at all these factors. And so we do a better job now of looking at everything and screening, obviously for ADHD and, binge eating disorder, eating disorders in general. And obviously we need to get away from BMI, associating BMI with eating disorders, because anyone at any weight can have restrictive eating and mobilize that mindset really quickly, which is how binge eating also starts too. And so you had a constellation of a lot of things. You have a strong setup for insulin resistance in your family. And so your body, there was a really good study, but it was out of Arkansas, and there were some researchers who looked at normative weight children, so children whose weight was in the healthy range for BMI, and then they looked at insulin resistance, and they controlled for everything, like what they're eating, and what they looked for was a family history of type 2 diabetes. And what they found was that if you had type 2 diabetes running in your family, you had insulin resistance. They looked at fasting insulin levels. And to me, I think this is the most powerful study, because I think that we should, and we don't talk about it in pediatrics, but it's insulin resistance was the setup. Okay. And so these are kids that, we should be screening for this. I'm not saying lab studies, but we should be screening family history, genetic predisposition for, in all weights. We should be doing this for everybody, all kids, and not just singling out or going with a BMI focused approach. BMI shouldn't determine, like, based on like screening and like what we do. It shouldn't trigger more screening or less screening, and it shouldn't be a treatment designation for BMI. I don't think we should even use it at all. So you had a setup for insulin resistance. And then you had on top of that undiagnosed ADHD. And yes, we're missing it in girls still. And parents, they look at things like the weight, when the weight is just a symptom. Always there's something there.
100%.
You got a metabolic thing going, or a lot of things going on. You got bullying in your home. Come on, you're gonna freaking eat. It's a legal thing that you can have.
It's the only thing you can try. Like when you're a kid, you want something you have access to that you can control, and you don't control anything. So what do you control? You can go down to the kitchen and get an Oreo or 5 or 10,
because you can control that amount. You can, when you can sneak in there. And
I think with ADHD, the thought for most people is it's hyperactive. And so you don't usually associate that with, a withdrawn,
Yeah.
Inattentive. Yeah. The boys who have it, they protest too much. The adults
Yeah.
protest too much. It's like they let you know, and a girl is in the back. I mean, I think I had it too. I was just a daydreamer, and so yeah, I understand that they don't. And now we're just starting to learn more about dopamine seeking too in the brain. And I love listening to Huberman Lab podcast. I mean, he's an awesome neuroscientist and just talking about like all the cool nerdy neuroscience stuff. And Dopamine Nation is a cool book. And when you have our processed food system and screens and everything,
Perfect
so
form.
yeah, I think that we treat with Vyvanse. That's a good thing for ADHD plus binge eating disorder. Okay.
Yeah.
Obviously it doesn't last 24 hours, it's a stimulant, so it wears off. So you have to have a multi-pronged approach. And the other thing is when I was in pediatric practice for ADHD, I always drew out like a puzzle, and it's like medication is part of it, but the parents have to have a whole approach to it.
Yeah. When I was 10. Okay. So when I was 10, they realized that I had dyslexia. And so I had to kind of go and actually learn instead of just memorizing, which is what I've been doing to get by, because I didn't want to be singled out. I don't want to be the fat girl already. Like I didn't want to be singled out anymore. So then I had to go through obviously like all the education and training around that to retrain your brain. But when that happened, they suggested that I take Ritalin. And my mom was like, no, her brain is still developing. I'm not giving her a stimulant. And I'm kind of glad she did. But at the same time, it's like, what if that had helped? Like, what if that had helped not get to the point of obesity that I had gotten to? What if, and I know, but I think at the time it was all based on the material that she was presented with.
Right.
And as a mom trying to make that choice, and as a mom who couldn't relate to obesity and certainly didn't think that her daughter would be at the level that I am now, and that's why I'm hoping like the things we're talking about here will give parents what they need in their arsenal to one, make that decision, to two, have that conversation, with their child in the best way possible, and be able to advocate for them with a doctor, if they're going to need to, because especially if they've had to do it for themselves, hopefully this will help them. I think we've given them a lot to work with, and we really thank you so much for coming here, Dr. Karla. We really do.
Oh, thank you. This is a great community that you've created, and so
thank you. Yes, we really have an amazing community here in TikTok, and it's been expanding through Facebook and Insta and all these different places. And so, if they shut us down one place, we're just going to go somewhere else. We're very, very, very loud. They made a mistake. They didn't realize. They always underestimate the obese people. They're like, then you made us well. Look out.
Yeah.
Where can people find more about you and your work? Like, where can they find you on TikTok? Where can they read your books? Things like that.
Dr. Karla MD on TikTok or at IME Community. So the power of the individual, when you say IME, it's like I am me with the support of a community. IME.community.com, Dr. Karla with a K, MD.com for my metabolic telehealth to see if you want to connect with me for a visit. I would love it. I'm on TikTok all the time. I'm on Instagram and Facebook. I publish a lot of articles on KevinMD.com, doctors on social media. I'm on YouTube. I am a community, and I have a podcast too. I am a community, and also I just started a radio show. It's called 80s Mixtape with Dr. Karla. So I play 80s tunes.
How fun.
And then I deconstruct toxic 80s diet culture. So that's
Tuesday, fun.
10 to 11.
That is a great idea. I remember seeing your TikToks because the Prince in me. I remember, and I commented. I was like, "You have Prince on your wall. You have
it's right behind me here. Yeah, I play Prince a lot. I have him on my playlist for the next
Well, I will put everything in the show notes, listeners and watchers, so that you can connect with Dr. Karla if you're interested in questions and all that, because she is a disruptor and an educator. So we like those here.
And Dr. Karla, are you licensed in like not just Nebraska, but like everywhere, correct?
Yeah, I'm licensed in 10 states.
Okay.
So yeah, I'll have to look on my metabolic telehealth.
Okay.
And also the other thing that I do is I'm a writer. So I have this beautiful children's book called The Magical Everywhere. And so my best friend illustrated it, and it's so cool. And speaking of like positive messaging. Every child needs like to know that they're magical. And
Yeah.
it's just so cool. And so people can get that on my website.
Awesome.
And so
Well,
anyway,
we will add that everything in the show notes so people can click
Mm,
to it. We'll do it
absolutely.
on the audio and on the YouTube.
cool.
Okay.
Yeah.
Well, thank you so much for joining
Thank you
us.
so
It's been
much.
awesome.
Thank you.
Bye.
Thank you. All right, thanks.
Oh, that was so great.
Yay.
Okay. Hi. Good conversation, yes?
Oh yeah.
I feel like I
I
finally
only
had
cried at
group
the beginning.
therapy.
I feel like a winner.
Right. I'm waiting till we're done.
I'm just saying there's so much trauma around all this. Like, it's very difficult. It's very difficult. And I think for even a parent that whether they can relate, like my mom who really couldn't, or a mom like myself with my son, like I would probably relate too much. And I have to be careful not to like put my stuff on him,
Right.
because it may not be a thing. It may never be a thing. And I talked about I can't remember if I actually talked about it because it's all starting to run together. We talk so much, but and I talk way too much. But I was out with my son one day, and I don't know why I decided to have this day to talk with him. But I said, "Hey, buddy, like I know that you like McDonald's, and that's great, like because he's autistic, and that's like a safe food for him. Is he only eats the meat, he doesn't eat the bread, and he likes fries. So I was like." That gas station over there, like for everybody's car, depending on the kind of car they have like premium gas, they have regular grade, they have kind of in the middle. And it really just depends on that car, what gas is best for it, what fuel is best for it, but it's all going to get them where they need to go. But we want the car to last longer. If it needs this kind of gas, we give it this kind of gas. And I was like, it's kind of like that. So I was like, so you just want to like, McDonald's, not the best fuel, but it'll get you where you're going because it's all fuel. And I was like, so maybe when we go, we just make sure we eat more of the protein, a little less of the fry, so that we are just evening it out. And we just don't do it every day. And that way we're making sure some premium foods, like when mommy makes you turkey taco, or when we have your spinach, peas, and pear puree, like you don't eat just, it's because he's autistic, right?
Yeah.
Like vegetables
Just
and
a
fruits
texture
and stuff.
thing, right? Yeah.
Yes, it's a texture thing. He'll eat it pureed. So whatever, it's a win. Or we'll eat like that. Or when you drink your milk, like these are all very good, like vitamins for your body. And so I was just talking about, and he goes, "Mama, that was really good. You should make a TikTok about that." And I was like,
Yeah.
"Oh,
That's a great
thank God,"
analogy.
because it's so hard to know the right thing. And I hope this has helped some parents. Like, I really hope. We'll find out.
Yeah. And I hope that we touched on it it's a very delicate thing,
A
it's
very
a controversial and delicate thing.
yes.
Um,
And
What
the
you
people
say
in our community
matters.
that we were able to identify that would be possible guests, they're currently are not on Wegovy for shortage reasons and things like that. And because that's the one that's FDA approved for our children, we'd opted that it just probably wasn't the best for this episode. So we are handling this subject with care because we know how precious our children are, and we know what we've been through. So I hope this helped. But we can move to classic sign-offs. I'm going to be easy. You're not alone. It's not your fault. Got it from Rachel. One of the
Right.
biggest reasons this podcast is here is because of Rachel telling me that one night when I was really struggling. And just know we're here for you. This has got you got medication for you now. You've got doctors for you. We've got people that you can talk to, and now you have more information to be able to advocate for your children if you need to. So, but it's been great hanging with you on my end. What about you, Rach?
I mean, it's been awesome. It was a great episode to join you guys on, and I really, really appreciate it.
Yeah.
And I think just reiterating it is not your fault.
Nope.
we
Nope.
appreciate
And
it.
clearly, you're not alone. We got a lot of people
And
following.
you
the
are
podcast
not
now.
alone. Yeah.
Mm-mm.
And it is
Yeah.
not your fault.
No.
What about you, Pat?
And I'm going to go back to the good old standby because I love her so much, Katharine Hepburn.
Yeah.
Especially, I think we could speak. It makes me think of it now too because I have been shrinking for so long and backing away and binging. So her thing is never give up, always be yourself, and don't put too much flour in your brownies.
And don't eat too many brownies.
I'll
No.
tell you, when you make a Katharine Hepburn brownie, you might want to give them away. They are so good. Yeah.
Yes.
Mhm.
All right. Well, that wraps it for this week. We've got several other things coming, including an episode on addiction and a lot of different things, because we're going to have the hard conversations, because we are going to solve this problem, and we are going to get loud and have more affordability and accessibility of these medications. So thanks for helping us do it, and we'll see you next week.
All right.
Hasta la pasta.
Hasta la pasta.